Today we will see the COVID infections. So you are now the COVID-19 infection is the diagnosis of the 2019 novel COVID-19. So here is the code U07.1. So we will see the all new codes in the 2019. So here is COVID vaccine we can code with the U07.1. Then the sequencer is COVID-19 is evidence found in your encounter or in your patient note. That time, we will code U07.1 as a sequencing first, and any other condition, then code is second. With the acute respiratory manifestation due to the COVID-19, that time the reason for the encounter is respiratory manifestation of the COVID-19. Then first we will code U07.1 and then secondary we will code the respiratory manifestation. Because patient coming for the COVID-19, then firstly we will identify the COVID-19, then second the respiratory manifestation. This is the respiratory condition, that is pneumonia, acute bronchitis, lower respiratory infection, acute respiratory disease syndrome, and acute respiratory failure. So all scenarios with the respiratory failure due to COVID-19, then first assign the COVID-19 code, then assign the respiratory failure code. So if non-respiratory manifestation with the COVID-19, that time we also assign the code for the COVID-19 as a primary, then additional manifestation as a secondary. This is the exposure of COVID-19. This assignment code is rarely happen. Sometimes COVID patient contact with the another person and they also enter test result is positive. That time we will code this the exposure. Sometimes suspected, that time suspected contact exposure, that time we will Z20 822. That means if the COVID-19 patient suspected is contacted with the another person or not is not confirmed, that time we will code this. Next one is screening code. Screening for COVID-19. Sometimes patient coming to check the COVID-19 test. That time we will code only Z1152 because this is the encounter of screening COVID-19. Patient also not know he is positive or not. They are only follow-up and checkup. Sign and symptoms. If the patient is a COVID-19 or not is not confirmed, that time we will code their signs and symptoms, that is cough, shortness, breath or fever. If patient know or 100% sure is a COVID-19, then we can't code the signs and symptoms. But if not confirmed or patient is not COVID positive, that time we will code all the signs and symptoms separately. Next one is, this is also same, positive or not, that time we will code this. Share personal history COVID-19, then we will assign history code Z86.16. Personal history means previous 3 months ago or 1 year ago, patient suffering from COVID-19. It's a follow-up visit for testing. Then encounter for antibody testing is only if the patient is a COVID positive, then continuously checking their antibodies. That time we will assign this code Z0184. Encounter for antibody response examination. It means the patient immune system is boosting or not. That time we will assign this code. Multisystem inflammatory syndrome. This is the condition. That time we will assign The first weakness, firstly we will assign the COVID-19 code, then we will assign the M35.81. This is the another condition. That's why firstly we will give the priority COVID-19 code, then another condition. Okay. This is the post COVID-19 condition. Sometimes symptoms or anything is found for post COVID-19. Then we will assign the U09.9. And if not determined is COVID positive or not, that time under immunization of the COVID-19 status, it means unvaccinated patient we will assign this code, and partially vaccinated assign this code Z28.311. If not vaccine taken the patient or unvaccinated, that time we will assign Z28310. This is normal. COVID-19 patient rarely found in your reports or encounter. So we will see your encounter and directly matching your these scenarios. Basically, firstly we will give the priority on COVID code, then another one condition. This is the basic in the COVID-19. It's a rarely found COVID patient encounters in the coding. So thank you.